Jeremiah Rangel from introawareness.com, and today I'm going to be getting a cupping treatment. And a cupping treatment is something that's been used for thousands of years in traditional Chinese medicine, and the technology is obviously here in the United States, been here for quite some time. And this is one of the best, most effective techniques that I found for my body, and I'm going to have one of my really good friends, Ian Somerville, who's a master massage therapist and a specialist of shiatsu. He is a man of many different trades and skills, and today this is my go-to guy for if I have any muscular athletic injuries or issues or strains or aches and pains, that he actually corrects it. So Ian's going to be talking a little bit about the difference between traditional cupping with fire and then the suction cupping, we have a couple different samples here. So tell me just a little bit about, to sum it up for people that have no idea what cupping is and where it comes from. What is cupping? What's some of the uses for it? And I can talk about my personal experience of why I use it in a second.
Of course. Yeah, cupping is really magical. It's the science behind it is basically creating a vacuum for the surface level of the body, the skin and the muscles. And what that does is that vacuum allows nutrients to flow out of a stagnant area like a knot. Allowing that fluid to flow out that's stuck in there, and that metabolic waste, allows new oxygen and nutrients to flow into that area and loosens up that area. So tell me exactly where you're feeling it and what's going on with you.
So today, I needed to tune up. The last time that I came and saw you, I was in a lot of pain. I wasn't sleeping at night. I couldn't sleep on my left side. I was not afraid, but I needed to make some decisions where I was going to have to go to physical therapy or have to find something, because it just wasn't working with me, and the working out wasn't happening. My shoulder was impinged to a degree where I couldn't do any pressing movements, which I have a kind of a old school. I'm a very adapted with my physical training, but I have an old school. I like to do some press and at least have some chest muscles, and because of that I actually couldn't work my chest muscles at all. So the last time it was tremendous results. I'm still feeling great about it, and at the same time I've been working out, using my muscles differently that I couldn't before, but it's time for a tune-up. So right now I'm just feeling, as far as range of motion, it's a lot better than it was before and actually after my last cupping time, so that lasted. But I just need another tune-up, maybe just a little bit of the attachment of my chest attached to my shoulder, definitely in the deltoids, maybe a little bit more of the rotator cuff and the medial part of the deltoids. That would be really great right there.
Yep, and working with an acupuncturist or someone that knows traditional Chinese medicine, they might go into the meridians and the acupoints. For this, pretty much going to work Western anatomy style, so I'm not really going to go into the acupoint part of it, but this will be enough so we're going to have a really great session, get him a lot more range of motion, and he'll be able to do a lot more working out and feel that difference.
So, you want to have at it?
Yeah.
I'll take a look at it. I'll move towards you so people can see. And tell me what you're feeling around. What are you looking for with your fingers or with your mind?
Okay, so with both my fingers and my mind, I visualize the anatomy inside my mind, and then I let my fingers, mostly my thumb, probe around and find any irregularities or go into the areas that he was talking about that he wants me to address, that he can feel. So I'll go into those areas, and then
I can tell right now the parts that you're there, they definitely need some work. I can tell it doesn't necessarily hurt. It did before with my last session, but this one, it just feels tight, feels tender. It feels like it needs some love. That's what I'm getting. Yeah, and I can feel where there's some stagnation or those the muscles bound up like a cable, and that happens in the deltoid a lot. The way the fibers or the striations of the muscle run down, kind of like a shield-looking thing, to the point here, and so feeling in where the pec major comes across and attaches to the humerus, and then the anterior aspect of the deltoid that comes down the front, I can feel where it's really tight, and checking the outside part, I can feel in here. So you're getting a good idea of what you're going to be working on today. And so then I map it inside my head when we're going to go into actually putting the cups on. Not only do I remember where the spots are, but then I can kind of lube up those areas and get the cups ready to be put on, as well as doing some massage in there to loosen it up ahead of time. So tell me a little bit about what is this thumper this particular one, because I have a few different versions.
So this is a thumper VMTX, and what it's for is for therapy. And so I got this so we can incorporate it into our sessions. Because this vibrates at 40 vibrations per second, no human hand can do that. And so kind of an upgrade in our sessions, we'll be able to use this ahead of time to loosen those tight muscles at a deeper level than our hands, no matter how good you are, ever could. So it's a really great tool, and we've been using it a lot for our sessions.
All right, let's get started. So how do you want me to just be face towards you?
You can just sit comfortably.
Okay.
And what I'll do is let's start in the back here, and what we do is about 30 seconds to a minute on one area, and then we'll move on, and for about 5 minutes or so, not maybe more than that, we'll go to this whole area and make sure the whole area is loose. And I don't want to do just what he was talking about, but I want to do the area around it a little bit so it gets even looser.
Yeah, it feels really nice. I feel more relaxed. It's just I can't really tell until it stops. Usually after the thumper stops, then there's just kind of like a wave of, yep, there it is. It's just like whoosh, whoosh, really nice. And then the range of motion is a lot better. Yeah, I can tell there's a couple points when I get way over here, which is to be expected because that's where we're going to be working on with the cupping. But yeah, feels great.
Yep, and even just a few minutes with the thumper, and that's already that much relief. So it's going to be that much better when we get the cupping going. This is my little proprietary blend of oils that I like to use. It's kukui nut and arnica oil and some essential oils that are really good at providing lubrication but not like greasy. And so I'm just going to go ahead and work on him a little bit on his chest and his arm here and kind of prepare the area for the cupping to happen. So maybe you can see, working even with my thumbs on these stagnant areas, we're getting some of the redness to come up, which means that it's starting to, or has a little bit of flow and movement happening already. But you'll see once I start getting the cups on, how quickly they're going to turn from red to even purple. And then we'll leave them on for about 10 minutes or so. Sometimes I go a little bit longer if change keeps happening, but when it gets to the point where there's no more color change, then we'll take them off. Sound good?
Yep.
Okay. Okay, so this first one, this fire cup, I'm going to put right on here, right on the outside of his deltoid. Okay. Let's see. And for the rest, for these guys, I like them because they're fast. You know what? I'm going to start out here.
So you're going to use the pump in this one, right?
This is the pump.
How can you tell when it's done? How can you tell when it's enough suction?
There's usually, for this one, it's about 3.5 pumps is where the skin starts to not come into the bell anymore. And that's how I know that it's as tight as it should be. Now, sometimes I might ask if that's tight enough or how does it feel, and if I see the wincing on the face, then I know it's probably a little bit too tight. But I've gotten pretty good at putting it on where it still feels good. It feels weird. If you've never had this done before, it's a different kind of sensation because us as human beings usually don't have experiences where our skin is pulled away from our body by something. So this is a little bit different kind of a feeling, but it feels pretty good. It's very therapeutic, and it's very different than what you would normally feel in a massage session.
So different people have different pain tolerances.
Yep, that's right.
So I have a pretty higher pain tolerance, so I'm not trying to be macho at all, but I just always had a higher pain tolerance, so I like to take as much as I can. But I always listen to my body as well.
Yep, and you'll see where the looser the skin, like right here with his chest, the more skin gets pulled in, and that probably doesn't even feel as tight as some of these other ones where there's less skin pulled in.
So what do you say to when your clients and you work with them and they do have pain, what's some of the pain techniques that you do with them? Let's say it's painful. Otherwise, obviously to make it less painful, take a lot of the pressure, but because you're saying the actual skin goes into the bell.
Mm-hmm.
That's where the suction happens.
Yep, skin goes into the bell, and then the muscle underneath it gets to basically relax, and that gets pulled on too. So what it does is this knot of a muscle, the fibers get space to expand and let go, and all of the metabolic waste, and that causes pain in the body, and that tightness is pressing on the nervous system. And so what that does is the bell helps it release and open up, and like I said, that waste can flow out, and new oxygen and nutrients can flow into that muscle. I'm going to go with a few more here. So we're going to go one by one and take them off nice and gently. These come off really easily. You just have to pull the little orange tab here, and it lets the air back in, and they come right off. But I never pull them off. You just gently remove them.
And immediately after you take it off, that you kind of...
Yeah. Either I'll take them off one by one and rub on them, or I'll take them all off and then work the area, which I'm going to do once they're all off anyway. So there's that glass one. And some nice marks here. It's one of the darker ones here.
Felt tender, a little tender.
Right at his pec attachment there. I'm going to move on to his chest here. Here are some of the darker ones. Again, up on his deltoid here. So this color, the lighter ones will go away in a few days, maybe even like lighter tonight and into the next couple days. The darker ones can stick around anywhere from a week to maybe 2 weeks. So yeah, that's not that big a concern. It's not anything unless you're really self-conscious about it. But
so that's one of the biggest things that sometimes people say, well, I don't want that to look like that on my body. Well, number one, it's not permanent. Number two, the relief. Like I always ask people, do you want pain or do you want, to look a certain way? Because most people, they don't see this anyway. And it's more socially and commonly accepted now, especially since
it's getting more popular, and people can always ask what's going on, and it's a great conversation too. Oh, I had this done and it feels great now, and kind of letting people know that it's out there. So yeah, and it always goes away.
All right, so that was completed the process. Got my clothes back on, I feel great, I smell better, I feel better. My range of motion is 3 times better, at least. I just feel lighter. Actually, I've been working really hard, and I just got over, there's a bug going around, and basically I feel a lot less stressed now is what I'm saying, is I had a lot more rest, and I was just kind of on the mend of recovering a few days ago, so now I actually feel like my head feels lighter as well. And again, it's just detoxing is one of the best ways, and with cupping, it's a really fast way, so I'm definitely going to do a lot of water for sure.
Yeah.
But some of the frequently asked questions is it permanent? Does it stay there? Well, of course not. If that was the case, then you probably still have evidence of hickeys back in high school or junior high and something like that, which obviously they their body regenerates, so that's not true. And then the bruising. A lot of times people ask, is it like a bruise? Is it really, tender to touch? And the answer is no, it's not like a bruise. It does bring the toxins up to the system, is that correct? But
yeah,
it's just...
it brings them up and out into your circulatory system. So you can't do too much at once. If you have knots all over your body and you're real stiff all over, a section at a time. Otherwise, it'll be too much for your circulatory system to handle. And it's not like a normal bruise, where a bruising, there's damage to the area. This just opens up the area to pull toxins out. And so it won't feel like a bruise at all. In fact, I can touch him and it won't feel pain at all.
Yeah.
So
feels lighter, feels looser. If you want to de-stress, I would definitely check in and do cupping. If you have any sort of injuries, any sort of pain, any sort of muscular imbalances, or any sort of tightness that traditional chiropractor, massage therapy, different ways you try different modalities doesn't work, definitely give cupping a try. And I would recommend, if you have any questions, to reach out, look at the link below and reach out to Ian. And you can visit insureawareness.com, and he definitely, locally in the Minneapolis area, we do a lot of different therapies that he offers. Coaching, whether sometimes it's the mind that's holding onto the body, so we actually do that. Traditional massage, but also really specialized in shiatsu as well.
Shiatsu or acupressure, and then I can bring in cupping and moxibustia like acupuncturists use too. So all kinds of tools and therapies that I know how to do that can help you for anything that you need.
So you're going to get some sort of an assessment every time, and then the treatment that's specially designed for what you need, and you're going to feel better and feel lighter and smell better at the end.
Yeah, guaranteed.
Awesome. So this is Jeremiah from insureawareness.com, helping you to elevate and expand and increase your level of consciousness and being of service to you. So thank you very much, and stay tuned for our next video. We're going to give you more insights and a different look on things you can do for your own health, mental, physical, spiritual, or financial as well. So thank you very much, and check us out at insureawareness.com.